Okay, so let's just define it quickly. ME/CFS. What is it? What are the symptoms? How do I know if I might be suffering from it? I mean, and maybe you can comment here on your own experience with it. I think your story starts with you going through it yourself, but how do we define it?
Generally, it's a situation where a person has these types of classic symptoms. The first one is post-exertional malaise, and that involves if you stress, if you basically do some exertion, you basically feel sick. So it's almost like as if you have the feeling of the flu, but you don't get over it. While exercise, often people feel better. Basically, in this case, when people exercise, push themselves, they actually feel worse. The other common symptoms are unrefreshing sleep and cognitive impairment. The Institute of Medicine came out with a case definition about 10 years ago, and I would say these are three of the key factors. And again, what you want to do is ultimately try to make sure that you rule out maybe other things that might be causing these particular symptoms. For example, cancer or heart disease. So certainly when a person has these types of symptoms for at least 6 months, that would be classified as what we call ME/CFS.
And maybe let's just speak quickly about the category more broadly. I mean, I'd be curious for your perspective on it. I would put long COVID in this category. I would put maybe restless leg syndrome in this category. Maybe Lyme disease falls into this category where you have these symptoms. I think for the outsider looking in saying, well, doesn't that happen to everybody? Is this real? Okay, I exercise and then I feel a little bit tired. I've got some brain fog. I think what happens when you double tap and you speak to experts like yourself on these topics, they are very real. We do have a way of having, of identifying, okay, who has CFS and who has long COVID. But can you just speak quickly to, I don't know, the difficulty of this category? We don't have tests that can tell you specifically, or there's not a blood test for CFS. And so maybe it's worth speaking, I don't know, to the skeptics or just about the difficulty of the category. Cause it's not like, I don't know, we've got flu going through our house and we can stick something up the nose of our child and say, yeah, they have flu or they don't, and then treat it accordingly. So you speak to that.
One of the big issues in this field is that people often wonder whether their healthcare professionals kind of respect and legitimize the illness. And you're right. A lot of people get, for example, SARS-CoV-2, which causes long COVID, or they get Epstein-Barr virus, which causes mono. But most people recover from these viruses and bacterial infections. But a certain percentage of people don't recover. And if you go back to the Spanish flu of 1918, a certain percentage of people never recover. So that's what we're looking at. Why does, in a sense, a virus occur, a bacterial infection, or something hits a trigger that basically a certain percentage of people seem to continue to be symptomatic over time? That is very hard for the healthcare and medical community to understand because the vast majority of people recover. So if most people are recovering and you're not recovering, then what happens is people say, well, it must be psychogenic. It might be something that's hysteria. It might be something that's really psychological, and there's really nothing wrong with you. That's the dilemma that these patients with long COVID, with ME/CFS, with Lyme, post-polio syndrome, vast majority of these types of infections that people seem to not recover from, they get not only the trauma of basically being sick, but then they're re-traumatized by the societal and environmental and medical reaction to the illness.
Okay, so for ME, and maybe this is true for all of these, they're in this category of, is it almost always a viral infection? There's some kind of infection, and it's an infection that we tend to know something about. Okay, COVID, we know a fair amount about that. And then the symptoms, they linger for an extended period of time, 6 months, a year, multiple years. Can we say definitively that it's always precipitated by a viral infection, by bacteria? Is that common across these conditions?
With ME/CFS, it turns out that the infection seems to be the Epstein-Barr virus that causes mono. And that, I would say, is something like the majority of people who have a viral infection, it's because of that. But there's lots of other viral infections. And some people actually don't even have a viral or bacterial infection. There could be other reasons that they basically have a trigger. Matter of fact, when we have gone over thousands of people and asked them what happened before you got sick, we actually come up with almost 100 different reasons for the onset. So yes, viral is probably the more significant and prominent one, but there's lots of other things. Some people have had an accident. Some people have had one of a variety of things that has caused some type of kind of brain inflammation that ultimately has these types of cascade of events throughout the entire body.
When you say something like a trigger, I think of this on off and I immediately think of epigenetics. I've got some lifestyle factor. I've got basically some dormant gene, and then I'm living my life in some particular way. And then the gene, for, just to simplify it a lot, gets flipped on. And then, okay, that changes something about my health or about the way that I live my life. And so, do we look at epigenetics here, or you had mentioned inflammation of the brain? I mean, you can tell me if that's epigenetic or not, or am I on the wrong track when I'm thinking about epigenetics?
I think you're on the right track. The reality is, got to think about 100 people, in a sense, get sick, and then a certain percentage of them, maybe 10%, after 6 months, don't recover after, for example, mono. But 2 years later, that rate might be down to 4%. So the question is, what happens? Why are some people exposed to the same stimuli, virus, bacteria, whatever, and some people, it sort of has a cascade of events? And probably that's the holy grail. What we're trying to understand is what types of precipitating, what types of predisposing conditions. So, for example, if you're older, if you have chronic kind of immunological prior infections, if you have diabetes, if you have obesity, these are all the types of risk factors that occur that make it a little bit more likely that when a person has that viral attack, something is going to happen that's going to make it much harder for that person to get over it.
Okay, so in the case of ME/CFS precipitated by mono, I imagine a typical experience is, okay, I'm not feeling really well. I go in to the doctor. The doctor says, this sounds like mono. We've got a definitive test to determine whether or not someone has mono. Okay, I'm positive for mono. So then I'm in a period of, I'm expecting to be suffering from the mono in all of the ways that I would understand in learning about that infection. And then for some period of time, up to 6 months, we would just expect that that's normal. Hey, it's lingering a little bit. That's how mono is. It takes a little while to get out of the system. And then at 6 months, somebody who's saying, wow, I go walk the dog and I'm exhausted. I've got brain fog all the time. Then we start to think about CFS. Is it that the symptoms don't abate at all? Or they do abate, but they just don't drop down to an acceptable level? What does it look like at that 6 month mark?
So sometimes they begin to decrease, sometimes they stay the same, sometimes they increase, and then sometimes those patterns, different things happen. In a sense, ME/CFS is a multi-system problem where one basically system goes awry. I think it's brain inflammation. Ultimately, that affects the gut, the gastrointestinal system, which then affects the circulatory system. So one system might be predominantly dysregulated, but then it dysregulates other systems. So in a sense, you have this spiraling that's occurring where sometimes the person is feeling a little bit better and sometimes worse. The biggest problem, however, is really what you're, I think, alluding to, is that because we're not exactly sure, there's a tremendous amount of interest in trying to understand it. And a lot of people ultimately are trying to blame the victim. That's very unfortunate. So what we should be doing is providing as much care as possible as early as we can. And we don't necessarily need to wait 6 months. If you're feeling sick and ill after a couple of weeks, that's when we should be intervening. So we should be intervening early. This is just a case definition of 6 months. For long COVID, it's actually closer to 3 months. as you probably have heard from some of your other podcasts. So the reality is the time is irrelevant. The key thing is, what can we do to basically help that patient basically get back to where they had been before they got ill?